But it says that the link is on our Facebook story. So you mind checking that when you're ready? And then Because I'm live streaming with my phone. Whenever you can take videos. I'm already starting to sweat.
Long live civil society, long live. Unite civil society, unite. Forward for social justice, forward. Forward with the constitution, forward. Shy political parties, shy. Shy political parties, shy. Thank you very much. My name is Mohamed Sisi Barsa. I'm from the Education Campaign. I'm the provincial chairperson in Gauteng. And in the audience, I have my comrades from Tech. Lovely, Tech, we also have Tipa there, I see them. Lovely, lovely. I see HEALA there, it's also here with us. Lovely, HEALA, lovely. I see community members as well. Lovely, civil society, lovely. I see the parties there, which the introduction is going to be done as the program will be progressing, comrades. With that said, we are now starting with our program, which is very, very important. I'm sure all of you are aware that we're in the elections mood, and as well, we appreciate that all of us are expected to cast our votes, and we have our different political parties here who are sending their manifesto to us to say they want to govern this country, despite all the challenges that we have. So I will then do what I'm supposed to do. So as TNC, we are here to actually engage in this discourse which plagues the country, the challenges that are affecting the majority of our people. As you will be aware that in this country, we've got a majority that is still left behind in terms of 30 years of democracy. So we're here to give a platform to community members to express their own views, to express their own interests, and also interrogate the political parties that are here to engage in this particular discourse. So under TAC, I will just start with what we stand for and engage on the issues, and then that I believe is going to create a platform for all of us to engage, because I believe all of us live in this country. Therefore, we are familiar with the challenges that we are having. Probably we also have solutions, and those solutions need to be expressed. I don't know in what days those will be the countdown towards the elections. So we've got 6 days. There you go. So in 6 days, I believe that South Africans are ready to go and cast their vote. So with that said, as you will be aware that sometime last week the president signed the NHI bill, as controversial as it is for other parties as well. So the fundamental issues that needs to be appreciated is that in this country, in terms of inequality, it's a reality even when it comes to healthcare access, despite what the Constitution is saying in Section 27 of the Constitution. Majority of people, 86% of our population, is still subjected to a dysfunctional public healthcare system. And I believe that in the philosophy of the NHI seeks to address that, those imbalances, those gaps as well. And as TNC, we support the NHI based on those issues. However, there are still other issues that we still think that needs to be corrected, because it doesn't come across as a silver bullet. And we've been through this particular process as well, where NGP was introduced but didn't live long to realize the challenge that we are having. That is the reality. So based on that, we support the NHI, and we want to see the governing party, which is going to the elections as well, telling us in greater details to say how it is going to be outlined in practical terms rather to be a political statement. Because people are waiting outside in the entire country, particularly the 86% that is disenfranchised. So we would like to engage around those issues. We'll be making our own observations, we'll be interrogating the document, however it still has no steps. Therefore, it will be very prudent of the governing party, which is the ANC, to tell us actually to say what are they going to do to ensure that they bring this particular game. But I want to also go through some of the antitheses of the society that most of you might be aware. So as TNC, we are part of PHI Center representing the interests of people living with HIV. So in this country, we have 7.9 people who are assumed to be living with HIV. 5.7 million of them are on treatment today. And we still have a concern around 2.5 million that are not on treatment. And when we engage those people are saying it is because the system itself doesn't make things possible for them. And that on its own is a serious concern. I'm very devastated about that. So at the policy level as TAC, we are advocating that people living with HIV who are on treatment must be initiated on 6 months multi-month dispensing, meaning that they have to go to the facility, in the clinic, get their treatment at least for 6 months so that they don't keep on going to the clinic, because that on its own is quite frustrating as well. So those are issues that we are concerned about. Coming to matters of TB, as well. In this country, according to the World Health Organization report, which says in South Africa we have 280,000 of people who are contracting TB on annual basis. Out of that, we have 54,000 of people who are still dying of TB on annual basis. 31,000 of that 54,000 are people living with HIV. And yet now we're celebrating the 30 years into democracy. Therefore, that is an injustice on its own according to Section 27. Where the public healthcare system that is experiencing a chronic shortage of staff, where people who are dying in the hospital, where people even in this province where we are at, who are even dying of hunger, out of 37 public hospitals in this province, 26 of them have been perennially experiencing issues of shortage of food. Despite the fact that the second item on the public expenditure, it is on health. And that on its own tells you where the problem lies. Corruption, dishonesty, dysfunctional system, lack of accountability, and all those issues are supposed to be engaged in your party's manifesto to say what is it that you're going to do to extricate this country from those challenges. Those are very fundamental and strategic questions that we want to pose. So that I think should feature in this discussion to you, fellow, what you call, I don't want to use the term MC, the moderator if you like. I think I'm very right, isn't it? Okay, so we still have patients that are living with cancer. Very recently, we were giving a match to the Department of Health because it's refusing to spend the money that has been set aside to address the issue of cancer patients. Cancer patients are made to stand in the waiting list up until they die of upward, a period of upward 2 years to 4 years. That's an injustice. Surely that's not something that can be palatable. So those are the issues. I'm trying to give a perspective around the issues of health. If you look at our healthcare system as well, in the province of Gauteng, if I can use that as a blueprint for this particular discussion, we have 37 public hospitals here in this province, and all of them have been struggling to comply with the Occupational Health and Safety Act, meaning that they can collapse at any time. The issue of infrastructure is a serious problem. If you talk about water not being supplied, we talk about staff, shortage of staff, talking about the dilapidated infrastructure, those are the critical challenges, especially if you want to implement the NHI. I think we need to pause and think a little bit to say, what are the possible modalities that can be able to assist us to achieve that particular discourse? So those are the critical challenges. Then socially, we've got problems of unemployment, people are not having access to food, which is covered as well in section 27, subsection 1, under B. So that on its own is a violation of the Constitution. What are you going to do in terms of improving unemployment, creating jobs, attracting investors, and all those? Because otherwise, I will defeat the purpose of democracy if you like. So those are the critical challenges that we are having. So as TAC, we are here. We need to participate meaningfully in this particular discourse, which is very important. I hope and pray that we're not going to see chairs flying around because people can't agree or people are disagreeable. So we can only hope for that, but I believe that because our democracy has been maturing over the period of 30 years, political tolerance is something that is a reality. And we want to say that we wish you well, we will be engaging on these lectures. We are willing to see you actually thriving towards the elections, and we hope for the best to those who are going to triumph beyond the 29. And another issue which is very important as well, despite everything that I've just said regarding the NHI, we still have political parties and other civil society organizations that are litigating against the NHI. NHI, despite its own imperfections, which I've just outlined, which makes it almost impossible, which is going to be subject for this discussion. I just want to check to those political parties, including the civil society organizations that are proposing NHI, perhaps this is a good platform to take us through in the logic towards that particular approach and kindly provide us with an alternative. What should be the alternative? Should we continue the discourse of the majority being segregated, being undermined, their constitutional rights being trampled upon, and of course we will continue to suffer that injustice? Probably that will be able to enlighten all of us as we go to the election. With that, I want to thank you all. Manja! Manja!
And thank you to all of the community members and the political party representatives that have joined us to take part in this discussion. At this point, I'd just like to emphasize that the point of this is really to get the parties to communicate their standpoints regarding their policy on food and health care. And a really important factor of this is community engagement. So we are going to open the floor up at the end of the discussion for questions from you. We want to hear from the community. We want to hear what your questions are for these candidates while you're here. So our next speaker is going to be Zimbini. She is an outreach coordinator from the Rural Health Advocacy Project, and she's just going to give us a couple comments from the Food Justice Coalition before we jump into the discussion with the political party.
Constitution, long live. Viva to the South African Constitution, viva. Phansi ngokunyasho kwamalungelo wethu, phansi. Phansi ngokunyasho kwamalungelo wethu, phansi. I-Constitution, comrades, is a mandate. It's a mandate. There's a mandate. Umthetho oya government people, abantu abaphathileyo, to actually we are using the South African Constitution that states that kufuneka isikhokhelo siqiniseke ukuba sifumana impilo engcono. Comrade from the Action Campaign, thank you for that context that is speaking on the dysfunctionality of governance, because issues ebezichazwa comrades from tech, the issues as caused by dysfunctional leadership. We need accountable leaders. As I'm coming from the Rural Health Advocacy Project, I'm going to touch on what happens when the system is broken. What happens when we are having leaders who do not want to listen to the people, but who what happens when budgets are not prioritized? We need budgets to be prioritized, to speak with the people. They must see that people. This is not, we are not asking just because we want to get whatever they say. We want them to listen to us and actually do the way. How can we go to a clinic and then when we get to a clinic at 5 a.m. we are going for Malang? Those are the problems that we are facing. The long queues that can be prevented. We are speaking of the conditions of abantu abahlale sithatha nge-clinic. Xa uya e-clinic, ufika kuthiwa uyakulahlekile, and then you are not to follow, and then you have education. But let me because it speaks to the obligations of the Constitution. As South Africa, asilingani nalokho kusazile inequalities eziningi asilingani yebona. So we are saying to the governing leaders, how are you going to bridge the inequalities of Black poor people, especially when it comes to health, especially when it comes to education, especially when it comes to grants, social security. We are also saying, how are you going to work on achieving the universal health coverage in 2030? Do you believe that you are going to achieve the universal health coverage by 2030? Because the universal health coverage speaks on the primary health care services that are mainly needed by the communities. Most of access to health care has been touched on when it comes to the implementation of the NHI. So what is important is how are you going to make it a point that primary health care services of rural communities, of townships and informal settlements are taken care of. We are speaking of COVID from Texas outlined the issue of why are we still having 54,000 people dying of TB. And it would be great if we can touch on why are we still having people dying of a preventable, treatable, and curable disease. Why are we still having that? Most of the things have been touched on. I want also to hear from Ms. Kokelo. Ms. Kokelo, how are you going to make the point that we have accountable leaders? What are your specific governance plans from a local level? We have clinic committees that are a governance structure, but they are not functional. If they would be functional, we would be having better access to private healthcare services. How are you going to speak on governance at a local level? The last one is, what are your specific plans on addressing inequalities in South Africa? The specific plans of addressing inequalities in South Africa, especially of the state departments that are outlined. Amanda.
Thank you so much for those comments, Nikki. So I'm just going to do a short introduction for what to expect from this discussion. So this town hall meeting is hosted by HEALA and the TAC, the Treatment Action Campaign. With the national elections coming up, they felt that it is important to give the community a chance to understand what the political parties are promising in terms of their stance on food and healthcare policy. And so they invited various political party representatives. We have joining us 7 different representatives, and I will introduce them individually. The way that the format of this discussion is going to work is that I will ask a question, and then each candidate will be given 2 minutes to respond. The order has been chosen at random, so there's no particular reason why a party is speaking in that order. And afterwards, it will be open to the floor for you to ask questions that you would like to present to the people present today. Just in response to the comments that have been raised by TAC and Myra, one of the questions will deal with the NHI and the 2-tiered healthcare system that South Africa has, so that will be included in the discussion. But if people have more specific questions that they would like to ask in the follow-up discussion, you are more than welcome to ask for more specific detail that may be afforded within the 2-minute time span of the answer. I feel like the previous speakers have done a great job at setting the scene, but just to give you guys a bit of context, the reason why this is so important is because access to good quality healthcare is essential, and it is a right for everyone. And while South Africa has seen improvements to its healthcare systems in the past 10 years, there are still major gaps and challenges that need to be addressed, of which I am sure you have all personally experienced and are aware of. The key areas that we are looking to address in this discussion are hunger, obesity, access to healthy food, and policy relating to HIV/AIDS and TB prevention and reduction and treatment. A lot of these issues disproportionately affect vulnerable populations and low-income communities and children. Food insecurity is a very important issue to address because it exacerbates health disparities and contributes to malnutrition and other health-related issues such as non-communicable diseases like diabetes. And we have seen in South Africa that with the growing barriers to access to healthy food, community members are being forced to rely on unhealthy food just because it is more affordable or easier for them to access. And this is causing a rise in non-communicable diseases, and that's why that is one of the discussion points that we are addressing today. And HIV/AIDS has always remained a critical health concern in this country, despite extensive efforts to try and combat this epidemic. South Africa has one of the highest HIV prevalence rates globally, with millions of people living with the virus, as the previous speakers have already addressed. And there needs to be more of an effort made to expand access to antiretroviral treatment and prevention programs in order to effectively manage this epidemic and bolster prevention efforts. We will also, as I said, be discussing the NHI as the bill was recently signed, and in order to get some clarity on if the parties support the bill, how they plan to implement it, or if they don't support the bill, their stance on how they will address the two-tier healthcare system in South Africa. So, without further ado, I'm going to introduce each of our speakers that we have with us today. So, first up, we have Kaleza, who is from the ACDP. She is a counselor in Ekurhuleni. Our second speaker will be Henry Masuku, who is the Bosa Youth Leader and candidate in the National Coalition. Third up is Irfan Monzera, who is the Civics Alliance Coordinator at RISE in Zambia. We have Bafana Shabalala, who is the ATN Youth League Chairperson. Our fifth speaker is Muzi Ndlovu, the ANC Regional Executive Committee member in Johannesburg. And the final speaker in our lineup is Michelle Clark, the DA Shadow Minister of Health.
Thank you so much. So 10 million tons of food is wasted every year in our country. That is 1/3 of the production. We need to make some serious plans to sort that out. That kind of waste is a shame and a disgrace when children are going to bed hungry. That is number one. There needs to be a national dialogue about such things. Number two that is very important is the stunting of our little ones. 1 in 4 of our children under 5 is stunted currently in our country. And this is a national tragedy. Why? Because it is irreversible. Those children's potential will forever be damaged. Mentally, physically, they don't get as tall as they were going to. They are more likely to get obesity. They are more likely to get diabetes. They are more likely to get infections. They might not even make it to adulthood. So another one of the interventions that is needed is for government to bring in laws to reduce the prices of essential foods. Poor people need to be able to spend their money on things that are going to make a difference to their nutrition and to their health. This is very important. Things like eggs need to be affordable, and our retailers could be encouraged to say goodbye to those markups. Then, of course, hunger is caused by unemployment, obviously, which is a huge problem in our country. So we need more jobs. We need to give incentives to businesses to create more jobs, especially for young people. We need to have apprenticeships. We need to give education to the workplace. There's no point in getting a degree if you can't get a job. We need to have policy certainty in our country so that we can attract the right investors and will bring growth to our country. We also need to help our small farmers. Farming is not easy. Anybody who's ever tried to grow vegetables will agree with me on that. So they need mentoring, they need access to land, they need access to markets. It's a highly scientific and technological thing, and it doesn't happen easily. And then, of course, to help people to survive and have enough money to buy the food that they need, we also need to make sure that our local spices are having an easier time of things. They need to have more access to the markets because most of our local spices are really struggling. Thank you.
We are not going to wait for anyone to fix the situation we find ourselves in, but we are going to stand up and do it ourselves. But more to the question, Build One South Africa is very inclined on the belief that we actually need to start programs in our communities, programs that will create self-sufficiency in communities. And some of those programs do include community gardens. We have so much space in communities that we could use to ensure that we can put food on the tables of our people. There is so many young people that we see on a daily basis sitting around corners. If we organize at least 20 of those young people and we give them a piece of land and we provide them with the basics to start a vegetable garden, I am pretty sure that they will be able to farm that land and be able to feed their families, first of all, but also be able to create revenue for themselves because they'll be able to supply small shops in the communities, but also as they grow, they will be able to supply even bigger shops and reach out to the market, therefore bringing the revenue back to the communities. But on the second point, when we talk about farming, people freak out because they believe that farming is this big thing. Of course, while we acknowledge that we need a certain level of skill to be able to farm and produce the products that you need to produce, we want to make sure that government and private sector partners with communities that have taken up themselves to say, we want to farm the land. We want to make sure that those young people or whoever is in the community or who is raising the land, they are trained properly on how to produce and work the land in partnership with government and private sector. But also, over and above that, we believe that each and every community, particularly in townships, informal settlements, in rural areas, we must establish food banks where NGOs can donate to that food bank, so that people who find themselves with the problem of hunger on that particular day or month or whatever, they are able to go to the food bank and be supplied with the basic needs for that particular period of time. And we believe that the food banks must be established in partnership with government and NGOs that are, most of them already participating in community programs that are happening. But over and above that, we need to put jobs in every home. Because if we know that there is at least one person in every household who is working, at least we can be confident that that family will not go hungry on a month-to-month basis or whatever basis. So, for sufficient jobs are what we need to create for our people. We must stop this dependency syndrome where we just want to spoon in communities, but we know very well that our communities are capable of taking care of themselves. Thank you.
I think it's still good morning. Rising Zanzi is the only party in this election that has prioritized hunger as one of the core issues South Africans are faced with. Because a third of this country is food insecure or doesn't have access to proper and nutritious food. And a few weeks ago, we launched our hunger plan in Malaysia, where we invited civil society to engage and speak in dialogue at the Citizens' Assembly. Our hunger reduction and crisis plan is an urgent one, but it's also looking at the long term. And rightfully said, the only permanent way to deal with this is to ensure everyone has jobs, dignified livelihoods, and income. But in our plan, we speak of 4 key pillars. These pillars are ending the violence of hunger immediately, especially amongst children, pregnant women, and poor and marginalized people. How do we do this? There's millions of tons of food that goes to waste daily by big corporates, by big retailers, by farmers, etc. A good government knows that we have to regulate it sufficiently and efficiently in order to make sure that that food, which is good and nutritious food, doesn't go to waste. It gets in the hands of the communities that surround those institutions and organizations. We also believe that the child support amount must be increased. This is an important one to actually get more food into the hands of families. We also believe that we must introduce a maternal support grant so that mothers have more access to resources to feed their children. We also speak about supporting single mothers who often have to choose between looking after their children and going to find work, and that's not something a society should be faced with. Support for food gardening is key, but food gardening on its own is not sufficient. It doesn't deal with the systemic barriers. And so, yes, giving seeds and equipment is a priority for us, but how do we give access for those small farmers to the market so that they can actually sell and earn a good livelihood and income from that? The second pillar is keeping the staple foods affordable. How do we do this? You regulate sufficiently an essential basket of food, which we fully support and agree with, but you also introduce food vouchers that you as communities can access at the big retailers. Should you be hungry, should you need food? That is a quick and emergency response to dealing with the food hunger crisis. Pillar 3 is about fixing the food system. It is broken. We are good at producing food, and 30% of our food gets exported. But we are situated in a lose-lose situation where low-income communities have to choose between going hungry or buying cheap and often non-nutritious meals. You see where children are drinking energy drinks at young ages of 4 and 5 and 6, or eating at the high reserve foods, etc., that are not good for their development and their growth. And so we need to ensure that nutritious food is available, it's affordable at a local level. Citizens need more democratic control over these systems, and so we advocate for a people's food system, and this is in line with global practice on how we make sure that the mechanisms involved are significantly prioritized at the community cooperative level, and not just at big companies and corporate level. The last pillar is about redistributing land and reforming agriculture. How do we do this? It's a focus on rural and peri-urban land. We are accounting, we know that it's a very urban area. How do we use the land available to make sure that it's productive land? How do we introduce agri-processing that is available, that is technology-driven, that's available to us as communities in low-income areas? How do we create green zones? For us, it's a priority to create green zones, even in urban centers like Johannesburg, where you have high-rise buildings. You can create a culture where ordinary citizens start growing the food that they want to eat, which is much healthier than going to the starter shop and just buying crisp and that type of things. And for us, it's a deal.
Sorry,
No, thank you so much.
Viva Orange Farm, viva! Viva Orange Farm, viva! As the ATM, our solutions to the HEALA problems are very much simple. HEALA is a two-tier problem, which therefore needs a multi-pronged approach. One, you need the availability of food. Two, you need availability of resources to guide the food. So we are saying when we address the issue of availability of food, we are saying that at the ATM one, we want the land back to the natives. We want to redistribute the land to the people, because we are saying people should have a garden, but the reality is that where we stay, we don't even have a piece of land that we can use or we can invest for gardening. So we are saying people are given secure houses where they have enough space to get garden. That is one. That is at a very low level. But secondly, we are saying in every district and in every land that is arable, there must be a farm. We have so much land that is left there, and it's now that land to can produce for us. So we are saying that land must be used to farm, and our people must be given skills and necessary equipment to can farm and farm. And then the excess food is then exported to other countries, and then there is economic growth. But let's come to the issue of availability of resources, meaning people having money to buy the food. Because we can have the food, but if you don't have money to buy the food, then it's good as expense. We are saying as the ATM, let us really industrialize our economy, meaning let us reopen the factories that have been shut down. When we do that, we are creating more jobs. It cannot be that in a country like South Africa, we are exporting a small thing as a toothpick. Then we can produce it now. People must be able to produce their own product, like the rest of the country. That is creating jobs, that is ensuring that people have money to get by. But also we are saying, let us create graduates that address the skills need of our economy. It cannot be that we are investing in courses when people graduate, they cannot be employed, and yet we are not employed. The reality that we find ourselves in South Africa currently is that when this current government took over in 2019, the basket food price was sitting at 30,000, and currently it's sitting at 5,200, 5,300, which is less than the minimum wage. So we have a crisis of availability of resources and people having money. We can say people can garden, but if they don't have the space to garden, where are they going to garden? And we are then told that people cannot farm. But in reality, is that when you go to those farms, it's not the owners of the farm that are farming the land.
Thank you very much, Aisha. Special teams to special greetings to HEALA and Rural Health Advanced Advocacy. Firstly, Aisha, I need to talk to the questions that were raised. I noted about the 11 questions that were raised by the Rural Advocacy and TEC and all these issues.
So I'm going to ask you to address that at the end. After you go through the full.
Okay, that's fine.
I'll give you time to respond.
That's fine. No, thank you very much. Maybe to your question. Obviously, we've been in government for the past 8 years. And in that 8 years, we would have addressed this issue now on our manifesto on priority number 3, where we are saying we are going to change the cost of living. And I think everything else must be around our manifesto. And I agree with my colleagues here that we have to start building food security. We have to make sure that all the necessities or it's very exempted, because then becomes an extra cost in our food. And we have to make sure that the food guidelines are actually emphasized for communities to make sure that our food guidelines. But also, what is important in the food industry is the issue of prices. And we would have seen entire prices of bread. And we know that bread is essential for every household. So as an ANC, we are going to make sure that the private sector does its pricing as per regulation. But the biggest important part is the land reforms. And I think my colleagues will touch on the land reforms a little bit. It is not correct that black people are now still bundled in areas that are inhabitable. It is not correct that black people are still in small yards in the townships and communal lands that are not farmable. So we are saying as an ANC, we are going to speak up the issue of land reform so that we tackle and advance the issues of socio-economic challenges that we are facing as a country. But we are also going to engage with my 2 minutes.
Sorry, can I just interrupt you a little bit? Can you just be specific about what exactly is the policy plan in order to address this issue?
Already there is a number of hectares that have been distributed to our communities, to the people, that especially those that will have ownership in terms of cultural or in terms of their trade. So there is land that has been distributed to them. But we are saying that all the land that is there and is not being used for agricultural purposes, it must be distributed to our people so that they can start farming. I think the gentleman from ATM did say that we need to make sure that people start farming their activities. But also, they won't be able to participate, but we are going to make sure that farmers are able to do mentorship, are able to make sure that their skills development is given to our communities. But most importantly, we need to maintain and expand the issue of subsidies on basic services, on housing, on water, and also on policies that the municipalities need to make sure that they implement. But also, we need to make sure that the national wage subsidies is increased so that it's in line with inflation, so that we are able to move in terms of what we are getting in social grants is available and in line with inflation. But most importantly, Aisha, we have to make sure that agricultural transformation happens. Because it is through agriculture that we can develop an economy. It is through agriculture that we can have creation. It is through agriculture that we can have poverty reduction in South Africa, in Thailand. But I heard my colleagues talking about food security. Food security, yes, it is important because on what we are losing in terms of 10 million tons that we are losing that ends up in land mines, it's not only about people losing their food, because we are also having a negative impact in the biodiversity of the country. And when we have a problem with biodiversity of the country, it means that farming on the land will be affected won't be able to farm positively and make sure that our people do get food. But Aisha, what is important is that we support and strengthen the draft strategy of reducing food losses and grants, which was put for comment on the 19th of September 2023. Because it is through that draft that food losses and the waste can be addressed in South Africa. Thank you.
So firstly, there's some very important statistics that people should know. 1 out of 3 children in this country die of malnutrition. It is a shocking statistic. Children should be eating at least 2,000 calories a day in order to make sure that they do not suffer malnutrition. So I know a lot about issues around malnutrition and food gardens, etc. But I would like to speak about the DA policy and what we would do if we had to go into government on the 29th of May. So we would immediately lift the child grant to 660 rand a month in line with the policy line. Secondly, we will ensure that each child remains on that grant until the day they finish their matric certificate. So, because that is very necessary while you're in schooling, that you're eating correctly and doing well in terms of your studies. We also make sure that every pregnant woman from the date of conception gets a child grant in order to make sure that she eats well and delivers a healthy baby. So we will do that as well. I also think that people must be cognizant of sound financial management within government. And if you root out corruption and you have sound financial management and consequences, what happened in government, you can increase your budgets to the necessities that people need in their everyday lives. And that's not happening in this country at the moment. We will also make sure that our community workers are paid far better, that they have a lot more resources in order to assist people when they need assistance, because that's not happening at the moment. And it's very well to sit here and say we're going to establish food gardens for people, help people with farming. When you do that, you actually need to put processes in place to ensure that people are actually coping with the needs they need to have successful food gardens and to farm successfully in order to create jobs on their farms, in order to sell the food they produce to the communities at a very low cost. It's also very important to reassess the zero-based food baskets continuously. And food like bone, chicken, meat, tin beans, baby food, tea, coffee, milk, those kind of foods that are everyday use foods in people's homes must be zero rated in terms of that. And the DA has actually submitted a kind of principle around what foods should be zero rated, and it was not approved in Parliament. So I just want you to know what happens in Parliament when we actually produce excellent legislation in Parliament and then it's voted down by the ANC. And that is the fact that happens. So by saying that we're going to deal with land restitution, I agree 100% we must do that, because the state sits with thousands and thousands of hectares of land which they can use in order to ensure that people live a dignified life and can utilize their land. They spend more money on VIP protection than on land restitution instead. So that is something that needs to be noted. It's rid of
focus on what your party will do as opposed to commenting on what other parties are doing. Okay. So our next question is, how does your party plan on improving service delivery for HIV and TB?
Thank you so much. To rely once more. The ACDP was a fighter for ARVs in the early days. We were the first people in Parliament who fought for that medicine for the rape survivors, and that made a difference because at that time you got raped and you were likely to get HIV as well. We were the ones that fought for, I think it was called the Virapine, to be given to those rape survivors. We also fought for national rollout of ARVs for mothers about to give birth. We in fact pioneered that treatment at a small clinic in Phosphorus, a little way up the road, and those drugs were given to the mothers when they were about to give birth, and it was discovered that the babies were born HIV negative, and that has made a huge difference, and now that's a major part of treatment. Anyway, so the ARVs for the rape survivors is part of the law, and later on the THC. Thank you to the THC for making actually. And well done to the THC for that. Okay, so for now, what we need is community health, primary health workers to get into the communities to trace your people with HIV or people with TB, so that they can be traced early, so they can be screened early, they can start on treatment. And then you need a friendly nurse to remind you to take your medicine. Taking medicine sounds easy, but it isn't. And often people who've got HIV, who've got TB, they are struggling in other ways, obviously because their health is not well. So for the community health workers to come to them rather than them having to go to the clinic is a great help.
I ask you to just elaborate because obviously there is a shortage of medical personnel and there is a need to upscale community healthcare workers. Do you have a concrete plan on how you would address the shortage of community healthcare workers and implement the policies that you just made?
I don't have the details on the matter, but I do know that medical negligence in our hospitals is millions of dollars every year. And if we can cut back on that, we can manage to have community healthcare workers and also to deal with the corruption. Sorry for not being more specific.
No, I think I cannot answer the question before commenting on some of the things that have been said here. The ANC has been governing for the past 20 years, and I want to know how much land that is distributed at this particular point. But
can I ask you to please respond to the question that I have posed? If the candidates would like to discuss their articles after the session, this is an opportunity for community members to gather everyone else.
okay, no, fair, noted. On this issue of strengthening service delivery, especially to HIV and patients, I speak from an experience as a medical professional myself. I am an expert professional, and I've had to deal with issues of this nature, right? So first, we must be clear that there is poor leadership in the Department of Health. Poor leadership, we have seen scandals of corruption. We speak of Teresa as one of those, but not only that, we have heard of ARVs that are being stolen, missing in stock. So corruption and leadership in the Department of Health needs to be dealt with, and it needs to be dealt with immediately. But now, we need to make sure that we also bolster up our infrastructure. Our infrastructure is broken, our clinics are broken, they are understaffed, and they do not have the necessary equipment to perform their duties effectively. But more to that, we need to make sure that in each and every community there is a mobile truck, a mobile HIV and TB truck that goes into each and every community, fully stocked with testing kits and also treatment for people that want to take on the treatment. But more to that, our clinics must be operational on a 24-hour basis. Why must our clinics be operational on a 24-hour basis? If you are a mother and you leave Orange Farm to work in Johannesburg in the morning at 4 a.m. and you come back at 8 a.m. and you work 7 days a week. You do not have the time to go to the clinic during the day. You must have the opportunity to be able to consult a doctor or a nurse in the night when you come back from work. But more to that, I think we're very clear on the issue of that our clinics are not capacitated enough in terms of staffing. You get to a clinic, there's only 3 nurses. There's only 3 nurses who are there to look after a long queue of people from here to come. You know, so we need to make sure that there's enough nurses, there's enough community healthcare workers, there's enough doctors, and even counselors for people who find themselves diagnosed with HIV. So the issue of staffing is a very serious one, and we want to encourage even what we are saying is that we must make sure what is called allied to healthcare professionals. These are nurses, these are physiotherapists, these are community educators and community psychologists. We must make sure that we make those streams of healthcare services more passionate, so that we can have more nurses taking up the job, more community health workers taking up the job, and infiltrating the communities, making sure that we create a database of people who are affected by these 2 areas. But to my last point, there is programs known as PrEP and PEP. We need to make sure that our communities are educated enough about what it means, what do we mean when we say PEP, so that people can prevent before they even contract the HIV in particular. But I just want to make a call, especially to the communities. It is and it remains our individual responsibility, first, to protect ourselves from contracting. Secondly, to make sure that we are on a regular check basis, to make sure that once you are contracted, you are able to jump onto the treatment and you can make sure that you increase the chances of survival. Thank you.
Thank you. Rising Planting for those entirety of the campaign have said, we need new leaders. And we say that because the leaders we have today, governments, don't care. They're disinterested to serve the people. And I say this because we still have a president going around, a former president, who denied the HIV pandemic. Till today, how do you account for the thousands of lives that were lost? And so we need new leaders. It's not just we need new political leaders. We need new leaders in our clinics, in our hospitals, in our NGOs who are already doing the work of serving our communities. I have a leader who I look up to in Rising Planting called Mark Haywood. And I thank him all the time because he was part of TSC that pushed against the former president and ensured that HIV treatment is available for everyone in this country. And so for us, we need targeted and monitored campaigns and systems to ensure vulnerable groups are supported with HIV treatment, with TB treatment. What does this also mean? It needs new innovative ways and using technology so that the 2 million people that rightfully were sent by my brother that don't have HIV treatment can get access quicker. But you also can't solve this because there are clinics that actually don't have the stock because they're not budgeted for it. The budgets have been stolen, the budgets are spent on skinny jeans. And so we need new leaders. We need new leaders. Let's step this sideways. There was whistleblowers showed that millions were spent on money for healthcare. Outside of that, you have the biggest spend on healthcare, but that budget has been decreased. So we need to deal away with austerity budgets that we have, because this government is there to kill us. That's what we currently experience. Lastly, or at least let me say 2 more things. One, sexual and reproductive health is important. You need to invest in this at school level, at clinic level. And Rising Planting says, to solve this crisis, you also need accessible and functional clinics in a 15-minute radius from where you stay. We are fighting for 5,000 clinics to open from 2018. Today it's finally open. There's not enough medicine. There's not enough needles and the basics to run the clinic. People there treat patients without respect. HIV patients who are now encountered because of the relationship of poor leaders in that clinic. And so you need to invest in that and proper education. Prevention is better than cure. And so you need to invest at a local level, education how do we make sure that this is a constant conversation that's happening? And then universal testing and coverage must be accessible. You can't have a situation where there are communities that are still begging for services 30 years into democracy. This should be accessible so that everyone in this country who is affected can actually access the right healthcare that they need. Thank you.
I want to tackle this question with a background. Health is a right, and anyone who stops you from receiving that right is impeding against your right to health. As the ATM was saying, for us to care and prevent HIV and TB, we need to invest in primary health. Our health system as it is, it's focusing on curative health in the hospitals. If you invest in primary health, you are doing what we call promotive health and preventative health. Once that is done, you won't need to have hospitals because people will not ascend to a level where they need to. We are saying in promoting and preventative health, we need to teach our communities about these conditions. But also we need to ensure that the clinics are functional and they are there. And mind you, in the current state of the public health in Gauteng, with the dilapidated structures and hospitals and clinics, 2 billion beds was retained in the previous financial year, and that money was used to revamp our hospitals. So the issue in our public health is that one, we don't have the political will, and that is what we're coming with as the ATM. But two, we are saying we need to invest massively in primary health, in accessibility of medication. Currently, the HIV/TB is run or rather is carried on by civil societies and NGOs. The government is absent when it comes to it. The Asian government is saying the government must be the leader of the society and must participate actively in ensuring that people do not contract HIV, but also that people, because TB is secondary to HIV, and it's an opportunistic infection that comes because of wanting access to medication. So if you treat people in your family with medication, people will not need to have TB. But also let us talk about the issue of ventilation. People live in houses that are not properly ventilated, and as a result, they need to resort to bonfires, which creates respiratory infections, which might lead to TB. But also their houses are not ventilated and they are clustered in one household. That is why we are also calling for proper human settlement plan, ensuring that the care of TB is maximized. And lastly, we are saying there needs to be a political power, and the government of the ATM needs to challenge or rather be a government in ensuring that healthcare is promoted in our country. Thank you.
Thank you very much, Aisha. You know, we have to give credit where it's due. The ANC is a leader of society. Being a leader of society, it means that we are leading individuals, we are leading communities, and we are leading the civil society. Now, why I'm saying this is that credit must be given to Zaki Ahmad. Who was the founder of the treatment prevention campaign, was a member of the ANC at the time when we founded the TAC. Now, and Zaki Ahmad was the one who was in the forefront of driving the national strategic plan of HIV, STI, and TB. Obviously, because we are a leader of society, we work with civil organizations to make sure that these plans are put into place. So that's why I'm saying we must give credit where it's due. TAC was the driver of this national strategic plan of HIV, STI, and TB, which eventually passed or implemented in 2007 and 2011. But as the African National Congress, guided by that particular national strategy, we have managed to expand healthcare services. And in those expanding the healthcare services, we've managed to make sure that health facilities, healthcare workers, and the dedicated staff of HIV and TB. We've also managed to prioritize the expansion of the ARVs or antiretroviral treatment programs for people living with HIV. I think also we want to see that about 5.7 million people are now on ARVs, and that is and we have implemented preventive campaigns. Yes, prevention is better than cure, and we know that we are not doing enough, but preventative campaigns have been done, and we are making sure that people are actually educated on HIV and AIDS, and also getting more information. And there is, Aisha, there is something that is prevalent that on education that we actually introduce, which is sex education in schools. And it might be a taboo for us as black people to talk about sex education to our children. But our children are now on social media, our children are watching TV, they are actually exposed to sex. And now we have to, as parents, make sure that sex education, we talk to our children because it took our sisters to make sure that we talk to them about preventative awareness. But also, we have integrated services and make sure that we promote integration of HIV and TB services in primary health care. And in that's why we are also creating the NHI to make sure that when we want to increase healthcare workers, we are saying let's consolidate the private sector, let's consolidate the public sector, and bring all these people that are working in those sectors, all the nurses working in those sectors, and all the specialists that are working in those sectors to come together and make sure that we give services to the people of South Africa. But also the ANC and government, it is guided by the World Health Organization. And everything that we do, we get guidance so that we make sure that we will start implementing what the World Health Organization is talking about. But what is important that I need to put across is that according to the surveys, which the South African National HIV Prevalence Incident and Behavior Survey, it says HIV in South Africa is increased from 14% to 12.7% in 2020, which means that as the government of ANC, we are doing what we are supposed to do. AIDS, which had given a 95 targets, as the South African government, we have made sure that up to date, we have at least achieved 90% on the first 95. And we've achieved, which is the first 95 is awareness, and we've achieved 91% on making sure that people are aware of their statuses in terms of their antiretroviral. But the final one is that the 94% that people in terms of their viral patients are actually aware.
The ANC is currently the ruling party, and several of the other members in their responses have raised shortfalls with the current HIV and TB policy and rollout. And if you could please just, I could give you an extra minute just to respond to how you would address what has been holding up the current rollout and how the ANC is planning to implement the NSP policy on HIV and TB, just to clearly say that and address some of the questions that have been raised by the other candidates. Sorry, Michelle.
Finally, it's just like we called Musa to whatever we try to speak or something. So I think we just need to be
Okay. Shall
Thank you very much. And yes, I salute Zakia. He's done an unbelievable job, and I salute TAC. I think they've done an unbelievable job. Some society groups like you, we could never reach outcomes that we need to reach because government just does not have the resources to do that. So thank you for all your contribution. Now, I do want to say that we as the VA will never stop fighting for vulnerable LGBTI communities. I'm a gay woman to myself, So I will campaign against HIV and programs that need to be put into place for vulnerable groups until the day I die, because I'm so passionate about that. So let's talk about the 62 million rand that was returned from the National Health Department this last financial year that was meant for HIV programs. So with the VA to come into power, we would make sure that some financial management reigns within government, and there are independent watchdogs that keep an eye on officials within government to see that they actually execute their duties and spend their budgets, because that is critical. And for us to reach the UNAIDS 95 strategy, we cannot be sending millions of rands back to national treasury because we have not spent it. And that is very we need the VA to come into power, fix the infrastructure of clinics, and make sure that we have community health workers and skilled staff within the clinics for prolonged hours in order to assist communities, especially in the rural areas where people have to go a long way to get to a health facility for systems. And that is critical, and we've done that in the Western Cape already. We have health hubs in the Western Cape that deal with TB testing, HIV testing, ARV drugs, and diseases like diabetes, heart factors, and that kind of health risks. And those health hubs are open 24 hours to communities. And that is what needs to be done. We cannot continue with a clinic. When you walk into a clinic, you hardly get greeted. Father lying low on the floor. Doctors come one day a week to see patients. You wait 5 hours for longer for ambulance. And I'm going to read to the left, spoke about the NHI, and we will address that just now. But I actually want to really do that. Ask people, have you read the book? Because if you haven't read the book, there's a lot of grey areas of that book. And that's the one issue that needs to be addressed, which is not in that book, is emergency services and clinics, which is extremely important. So we can also talk about our position going forward, because that's in the next question. But those are the issues: infrastructure, skilled staff, management of budget, internal fraud and corruption, and actually have people in the system that want to treat people and care about people, not just the job.
In order just to give, because I think there's been a lot of information coming up, we are going to open the floor to questions. We're going to take 4 questions from the audience, and then we'll return to those pretty scripted questions that we have for the panel. So are there any audience questions at this stage that you would like to ask? So we start in row.
Good morning, everyone. I have a few questions for each and every single person. As his name, I cannot go, and I'm going to say how it is. As his mother, you said that you were a counselor of if you go to the building, will they before you were a counselor and after you have go to a counselor at the clinic specifically? Because you said you were a counselor yourself, if you go there, you will be able to show us the difference that you have made. Before going nationwide, have you done where you are? And not going to the people that they say that they change has really go to the community, will they be able to say that she has that influence?
But we're observing. There's an order. There's already an order. Yeah, and then the question has to be answered most first. So they're going to ask again another question and they'll put their hands up again most. You can also say I'm operating here. Yeah. No, we will not forget you. She's been noted. There's a team, Mikey.
Owes money to the metro for the next person. Yeah. Our clinics are struggling because of that. So I set up for them.
Sorted.
So I've done everything I could to make that difference. As far as this debate goes, I'm speaking on the national policy of my party. But thank you very much for the question.
I'm going to ask you this. When we said that, when we were talking about policies, you all said, how are we going to fund if we don't have land?
Sorry, I just want to, in the interest of time, I just want to limit everyone in this section just to one question. We will open the floor up again for a longer Q&A at the end. Thank you.
Thank you very much. I think I got the gist of the question. My sister, I think what I wanted to do was to correct the fallacy that's going around here that says that we cannot farm because we don't have land. There is what's called horticulture. Horticulture, good background. I would take my head of child. Ukungakwazi ukutshala ngemva kokukwalaza ematayeni uzokwazi ukufika umndeni wakho ukwazi nokunikeza umakhelwane namakhonsa. So yes, land restitution is a priority of the state. But in the interim, we can begin by teaching families how to farm in their very lands without going through the process to try and get a piece of land. You will land already in your house. Can you try to plant something that will feed your family on a daily basis? Those are the problems that we're talking about. Thank you.
Do any of the other candidates want to respond to this question?
Sure. I think the question was for all of us. So, thanks, Maria. Absolutely right. And that's why for us as Rising Country, our one pillar in the four pillars speaks about land redistribution. We can't have, and as much as I respect our people out there, yes, we can farm in your backyards, but how many of us in townships have backyards? So, access to land is about dignified access, so that we can actually use that productively, and use that, and do the town planning necessary, because also having a piece of land is not sufficient if there's no water system that can give you irrigation for that growing of crops. So ours is a holistic approach to make sure everyone has access. But that access must also come with the necessary services, which all our municipalities are showing us. They're planning and thinking ahead about how to put those out services and make it available for people. Thank you.
I thought you would explain my response. You said one, expropriation of land without compensation. We can have balance in our neighborhoods, that is just a change. Then we must turn to the green business, which is contributing 170 billion per year into the GDP, which is agriculture. We must have funds, and our people must have access to those funds. We are saying all the agriculture in South Africa must be farmed and must be able to produce farm. We are saying in every household there must be a farm. In every household, the person must have either shares or the whole farm, because the land that we live in was not given to us. We must benefit from it. We must not benefit a minority few.
It is a fallacy that we go around saying that we can farm. If you go to the farms, and I know this is a touchy issue, you go to the farms, it is our black brothers and sisters who are farming those lands. It means that they do have this thing to farm. So we can't say that the people can farm. Now, as the ANC government, we are saying expropriation of land without compensation on the land that is currently not being used must be put into the forefront. My gentleman from Musa seems to be disturbing and we've been quiet in our speaking. Now, we are saying black people must be given land so that they can start farming. Yes, it starts in your yard, just to have food, just to have cheese. But when we start having land, you should be able to farm. Yes, we are saying we must not we must not bring fear to potential farmers because food security is important. But we are saying that our people must also start farming so that they are able to contribute to the society, so that they are able to contribute to the GDP. We've got young farmers already now who are keeping ranching. We've got the farmers already now who are doing farming chicken. We already have the sisters and the brothers who are already doing a crop farming. So in this age, the tendency is to say that black people cannot farm. Thank you.
Thank you very much. As I said previously, it is all about making sure that programs are implemented. So if a person has a piece of land to farm, they don't have farm, they don't have tools to actually farm their land, etc. Those programs need to be put in place and people should be assisted. I mean, I'm not a farmer. If you give me a piece of land, something can die in the next month because I don't know how to farm. But we need programs in place from government and assistance from the government to make sure that we are brought on board and show exactly how to get benefit from that land that we are farming. And I must just say to my little friend next to me, you speak about land and you speak about land restitution. And the DA obviously is against land appropriation of land without compensation. Because how would you, as a black farmer, that you put the whole livelihood into your farm, and your farm is appropriated? We must think of those, because there's many black farmers in this country that make a huge contribution to the agricultural sector. And government has huge amounts of land, pockets of land that can be assisted to people that need to farm. That is a fact. And the government needs to do that. And I can tell you that I seem to not support that role. I wasn't part of it myself, but it got to place. So thank you very much.
Good day, everyone. Mine is more on issues of key populations, including women. I think it's not fair that it's saying we have prepared. That's doing that initially for the safety and protection of key populations. But in this country, we are sitting in a country where, and my fellow TC complaints can attest to this, we have been fighting with the government, saying you should be but you see on the shelf celebration, someone in the ministry of claiming that all things, all activities have problems. We are a country that has been about to have problems. When it comes to key population, they don't even have their targets. Number two, we only even have, remember that key population are part of the people that are suffering from mental health issues because of different discrimination. I'm asking from everyone on the table, how are we going to make sure that when it comes to key population, they find it free to go to their access to quality health services? When it comes to women, as women are suffering from all sorts of cancers, especially cervical cancer, we cannot be a woman to go and participate. And I was willing to work as a temp outside. And as a woman in South Africa, South Africa, I am compelled to go outside the tent that doesn't even have a close tent to go and do participate. How is it fair on me? We must only come here to toy with mental issues, and we have poor communities that are afflicted. So you must not come here with your United Children Finish and think that you're going to buy our own.
Thank you for that. I think those were some really important comments and points that you made. Would you like any particular candidate or all of the candidates to respond?
Thank you so much for the question. I think it was an excellent question. Yes, the ACDP does have a special plan to help women with counseling, pregnancy, and so on. And when it comes to crime and so forth, we want to put special plans in place. We want special courts for sexual offences which are mainly affecting women. And when it comes to mental health, yes, mental health needs to be taken seriously in this country. And even the private sector is not doing very well with mental health when it comes to health services. So thank you very much for your points. We do have policies, but I think we can do better. I will go back and talk to my people.
No, siswa msio na kweli. Kama mwenzi, kama kuhusu hapo. Abandeli. Kakurasi namhlanje ngoba sikhuluma nomphakathi owona affected issues like that. So, ngicabanga ukuthi bese sikhulile sonke. Kakurasi ubumile ukuthi uhulumeni esinawo manje uhlulekile ukumeka sure ukuthi izibhedlela zethu maklinikhi wethu zisebenza ngendlela futhi zisiza umphakathi ngendlela efanele. Yingakho kubalulekile manje ukuthi sithole abantu abaneqiniso lokuhola, abaneplani lokuhola abantu umphakathi. Ngoba it doesn't make sense ukuthi you wake up at 4 a.m. to a clinic with a single headache, and you have to wait there for 3 hours until the clinic is either open or even when they open it, in Managua. If the condoms is one of the issues that we must emphasize, especially to our young people, to make sure that they use condoms when they are engaging in those activities. And you are right. Government does not make sure that there is sufficient provision of condoms, either in a clinic, in schools, in wherever you go. So we must make sure that it is compulsory for the government to make sure that every public space has a sufficient supply of condoms. And that must be the case. In fact, if you go into a clinic for any other unrelated or related things, you must come out of with a pack of condoms, or a visit must be offered to you to say, take this pack of condoms, whether you use it or you don't use it or give it to someone else, that's your business. But you must be given a pack of condoms to go and use it. Let's think about mental health. You are right. We live in a society that has so many mental issues as it stands in this country. Even young people, even our young people, there is mental issues in our young people. Which is why, as Bill wants South Africa with Muslim money, we have proposed that from the beginning of early childhood development, this is the migration. What we call a psychologist and psychiatrist. To make sure we can say, you know, as school, see, going into primary education, or private school, high school, that does not show a psychologist or a psychologist. So that we can try to address the trauma that the ANC government has put our people through the 30 years of the election. Every problem that we have in this country today is can and will be attributed to the government of the ANC that has failed to be progressive to ensure that they meet the needs of our people in this growing economy.
Henry,
So that's my last point.
Henry, I'm just going to ask once again, you don't attack any particular party.
Gotcha. Ngisacela ukuyibamba nasisona. Kodwa ngisacela nje ukudlulisa kuwe umyalezo othi siyabuzwa siswana. Futhi siyabonga ukuthi ukhulume nathi before sifike eParliament noma legislation. Siyabonga ukuthi usitshele ukuthi ufila kanjani. Sizokwazi ukuthi besifika le sinayo imandate ephuma kuwe njengomuntu womphakathi esiyofike silwele sineke show ukuthi silungisa izinto masikhuluma sona.
Thanks, my comrade. I want to address 4 things. And I'm sorry it's in English because my bundles are not run out yet. But I want to say, firstly, thank you, because people like yourself have been part of why RISE exists. It was in 2022 when we convened our chair. I think there's noise in the back, please. In 2022, we had convened a nationwide conference of movements, HEALA, TAC, ABC, many NGOs, civics, to say what is happening in our country and what do we do. It was in that moment that the idea of a new political alternative was born. I myself have worked 15 years in civil society, so I interact with many comrades of TAC, of HEALA, etc., etc. I used to run almost 30 plus youth programs in this province, in Orange as well, taking young people why they must be active citizens in this country. And so, RISE is a movement of active citizens, of activists from civil society. And you see, because we have a dedicated program for civic alliance, which we believe we must work consistently and collaboratively. And so you're right in saying the one issue is that the parties will come only in election time and then they don't come anymore. RISE is strong because hosted citizens' assemblies, town halls like this, but we prefer not like this because it's top down. We like it when it's a circle because that's when all citizens have the ability to speak and engage. But I also want to say that vulnerable groups are part and parcel of our approach. And so a few months ago, it was in Orange that we supported the queer community hosted RISE. And part of that was discussion around how we prevent violence against those vulnerable groups. So our approach is about bringing dignity back to the ordinary person who's been stripped away. I don't want to go down who's responsible for it, but yes, dignity is part of us. And our policy is different. Hunger policy, water policy, menstrual health policy. Very few parties have these policies because they don't listen to what the community are saying is the problem. We have been doing that work because our manifesto is cultivated from the ground. Healthcare, and what we speak about as primary healthcare, is where mental health services should be available. Not just the psychologists and psychiatrists, but if we think of mental health, it's the availability of sports and recreation and cultural activities. Our communities and malls like this end up being empty during the week when there should be spaces where there's regular programs, education, and cultural that allow our young people to find expression so that there's a positive outlook on how to deal with mental health care. Not just dealing with the after effects, but dealing with it from beforehand. And so, creating conditions and environments where people can actually love with dignity, love with access to these services is important. And then lastly, you will see us consistent. You see the boards of Orange Farm, it's because our volunteers and organizers are in Orange Farm. It says we need new leaders because they are the ones standing up and saying we are the new leaders and citizens from it. When we launched the health policy, the person who spoke at the panel was a young woman from Orange Farm who runs a farm, a small farm. And she says, we don't have a government that cares. We do this, we don't have seats, we don't have equipment, we can run it ourselves. And we said, we are here to support you, and we'll be the ones to support you, even after election, because that's who we are as new leaders. And therefore, we need to elect ourselves as new leaders into government. Thank you.
This is why we support the HEALA.Coalition. Mental health care is reserved for people in life because the reality is that you cannot environmental issues in the native communities. So that is why we are saying as the ATM, we need to invest in primary health care, but also we need universal health care coverage to ensure that access to mental health is for everyone and not just people in countries. We ensure that even school health is invested in, because we have a problem of school health. It's just that the current government is not implementing, and that is why we are seeing there is no political will, and that is why the ATM is happening. The frustration is very much understood, and it's because of, it's not only you that is saying the frustration, it's us as well. Reality is that we are political parties existing to ensure that our people receive the services that they deserve. Because look at the assisted for example. You have things that are not there. Infrastructure that is dilapidated. You have shortage of staff. You have shortage of material resources. But what happens to the Department of Health? If okay, 2 billion is returned to national treasure. That was not used by the Department of Health. That could have been used to ensure that the clinic is where we need to be. That is why we are saying we lack political will, and that is what we are doing as the ATM. We have the plan, and you find it in our manifesto. We are saying invest in primary health, because primary health is where the community is at. When you invest in primary health, you ensure that mental health is addressed, you ensure that issues of accessibility is addressed. But also, lastly, we are seeing the frustrations that we have as the community. Fortunately, democracy gives us another opportunity to say next week Wednesday, we must make a decision to say, I will continue to live like this and make the decision that we are making, or I will make a new decision. Thank you.
We've got just a simple strategy that we are using that says Amani. So in our branches, we've got counselors, in our branches, we've got leaders who are driving the policy implementation and making sure that all government spheres are implementing what is required. So that when we go there to the national conference, we call all our people to order. We call them with something that is tangible. And but you are correct, my sister, in terms of the accessibility of condoms. It mustn't only be at hospitals and clinics, but in public wards, like in school right now, you're supposed to go to a bathroom and be able to get accessibility to condoms. And also at school, we're supposed to be getting accessibility to condoms. But our focus is not only on that, but we are saying in the African National Congress, we are also bringing packages of young child, which are called dignity and pets at schools. So not only are we focusing on the boys in terms of condoms, but we are also saying in terms of dignity and pets, they must be accessible to our children. But on mental health, the African National Congress has started to make sure that from the school level, there is education on mental health. Because we are seeing that mental health is not only about which market integration, but I know that depression and as we know on depression, because it was legally out, not legally, it was before saying there's a movement about control. But it's saying bullying is coming from mental health. We are saying depression is coming from mental health. We are saying stress is coming from mental health. And if we don't deal with all these issues, that's why we are getting access to drugs. Children are getting drugs because of issues of mental health. But we are bringing those medications at school level through our school abuse. We are actually engaging communities on issues of mental health. Through our social workers, we are engaging our communities on issues of mental health. But the NHI has been something to know. All these people that have been, we are calling them flight. They have been leaving public hospitals going to private hospitals. The must be able to start working with our communities and making sure that accessibility to basic health is realized by all our communities. So by supporting the NHI, which other political parties were not supporting, because they do not now have the love of our communities at heart, because they do not have NHI. But NHI is there to make sure that everyone is equitable with access to health. Thank you very much.
because I believe in this country and the people of this country. And I am totally opposed to politicians to their offices and managing constituencies like that. There is beyond ground working. When I drive into my constituency, cut off, Bushgate Park, Lindenlawn, Davidson, I know every corner of those areas. And all the residents love me because I'm there on the ground assisting. I put a motion, and I'm going to talk. I was a councillor for 3 terms. I put a motion into Ekurhuleni for dignity plaques so that should be the criteria at clinics. My motion was turned down. Okay? Then when I went to the county legislature, I put in a motion about sanitary ware because it is shocking what young girls have to go through that cannot afford to buy sanitary pads and how they must live. They stay off school because they are embarrassed. They use newspaper. It is just shocking to know. And I put a motion at the county legislature to force government to do that. It was turned down. Then I went to Parliament and I did a private members bill on this matter. I did a private members bill on upskilling health staff and doctors and training. I did a private members bill on recommendations that are put into legislation without any communication to any people on the ground, to communities, because the Minister of Health has that power to do that. And I don't think that's right, because if they're going to change something in our system, they must come and talk to the people on the ground about it. My 2 private members' bills are still waiting to come to Parliament. It's taken 2 years for that legal department to finish up with my bill and say, it's okay now, we'll bring it to Parliament. So really, I don't think politicians just sit up there and do nothing. I want to also tell you a story because these guys have had a long time. Multiple times, I went to the Mother World Clinic. You know that the nurses at that clinic did not help her. They just said, let's go to the police station and contact her. We haven't got records. By the time she got to the police station, she died. She died. Now, if that family did not contact me, and I didn't write a report to the ombudsman to have it investigated, those 2 would still be employed today, doing that to people on the ground in vulnerable areas. They were both fired. So, that is what politicians must do. They must go onto the ground and see what the issues are, and they need to raise them in Parliament, whatever legislature they serve. And they must write laws in order to change what's going on. And that's what we need to do. Otherwise, you are worthless being elected, in my view. So, Aisha, I feel your pain because I've been to so many hospitals and clinics in my life, and you see the bad services that communities get at our clinics and hospitals. And they talk about mental health. You are aware that if you're admitted to hospital for a mental health issue, they can only keep you in the hospital 72 hours, and then they have to put you into a facility that deals with mental health, which we have so few and far between. So what happens is patients are stuck in casualty, lying in beds for days and weeks without any assistance to assist them with their problems. So until we deal with the inequality in this country and bring people on par, like every South African on par, we will never ever reach these points. And that is what we've got to work at every day of our lives, to ensure that people of this country get the services that they so deserve. Thank you.
Thank you everyone for your responses. Just to let you guys know, because we are running a little bit over time, we have to change the format a little bit. So I am now going to ask one more question, and I'm going to only give the candidates 1 minute, and this is going to be a very brief answer. we're going to be quite strict on the 1 minute time for their responses to this one. And then after I ask the next question, I'm going to give each candidate 2 minutes to share their comments or feedback on the NHI bill, as opposed to the pre-scripted question that we had previously. And then just also let everyone know that there will be lunch provided at 1 o'clock. Okay, so for the next question, can each candidate please share what their stance is regarding food labeling and nutrition and how to get packaged nutritional food?
Thank you very much. Food labeling is a great idea, but the manufacturers must bear the cost. What we really need, though, is more food. Health inspectors going to our local sponsors. The sugar tax must go. It's not helping poor people at all, because it's still, those sugary cold drinks are still cheaper than buying other food when you're really hungry and you've hardly got it in mind. When you want to beat diabetes and obesity, we need to bring back the sporty schools. We need to focus on traditional African food and move away from the Western diet, which is very unhealthy. Thank you.
Thank you very much. I think the problem starts with the production. So we are very much aware of the fact that there are some production houses, even within our communities, where there is illegal production of food in the communities. Where you go to the sponsor shop, you buy a tin of tin fish, tin fish is either not left good for the expired date whatsoever. So we must make sure that we have a body that regulates, and it exists. We must have a body that strictly regulates the manufacturing of food products, making sure that even when they go on to that food products, they label it correctly, labels even in different languages. Because sometimes you read the package of the food and it's in English, you don't understand what nitrogen are, you don't understand what this is. It must also be localized for our people to be able to read their local language so that they can understand what that packaging means in itself.
Thank you. We recognize that eating habits is not just an individual choice. Marketing companies are heavily influencing the way we eat and trends involved in this. You are seeing in our communities, Coca-Cola, all these very bad drinks and foods being advertised. And so you have to deal with the marketing companies, put in place regulations and make sure that they are aware and they are interacting with how we see nutritious meals being advocated for and delivered upon for local communities. It's also the adoption of nutritional labels that are visible, accessible, easy to read. And thirdly, we want to advocate once again for the implementation of the National Health Commission, which can help regulate and ensure that health promotion is a priority for any government at all levels to ensure the private sector is under the regulation of making sure that they deliver nutrition. And when people are given a choice, that they know that they're eating foods with high sugar content, etc.
Okay. Thank you.
This speaks to myself. We need to create a society that is a healthy lifestyle. But the reality is that you don't have programs that ensure that we have a healthy lifestyle. For example, in schools, we don't have things as a tennis court. So we as a teaching government, we are saying, once we are focusing on creating jobs and all those things, we must create a society that practices safe lifestyle and healthy lifestyle.
Sorry, just in the interest of they need to respond to the question, can you just discuss food labeling and nutrition?
And then when we come to food labeling and nutrition, reality of the matter is that our people don't know the labels that are there in the back of the food. They don't know what are actually saying. Even the calorie count, they don't know. And that is why we are saying we need health promoters and health inspectors to ensure what is labeled here is actually there, but also to teach our communities to say what do these things mean and what I'm getting from eating those foods.
Thank you very much. I think regulation R146 speaks on food labeling. So we just need this government to make sure that we enforce that particular regulation, because we know that private companies seem to be doing as they like. That's why I made an example of the Tiger Brands, that we looked into them and we saw that it was price mixing, and we we actually came after them. So even on food labeling, we must make sure that we enforce that as government, because this is the main government. But on sugar tax must still be there, because it will actually be able to make sure that we discourage the consumption of sugar and drinks. Because if we don't do that, we will still see people consuming those. But we should be able to say, if you consume sugar and drinks, you are prone to be obese, you are prone to have access to NCDs. But most important campaigns, those are things that we are supposed to have. That's why
Okay, sorry, that's a minute. Thank you.
That falls directly under the Hospital of Trade and Industry, and they should ensure that their programs are in place that they do have, but don't enforce. And they should make sure that the inspectors are out on the ground checking shops that do not comply to the requirements of labour. Now, let's talk about sugar tax. So, a huge amount of sugar tax goes into local. I asked the Minister of Health at the beginning of the year if he could please unpack what they do with the sugar tax that benefits the health sector. And they could not give me the answer. So, it's very well that they charge sugar tax, but it's not going into improving health. That I can assure you. So that's one aspect that must be driven of the government that takes over on the 29th of May, and I can tell you that.
Okay. Sorry, can I just, because you mentioned sugar tax, can I just redirect you a little bit? Do you have any comments on the front and back labeling regulation or the nutrition labels?
Yes, I do. It must be very clear what is in that product, and it must be regulated. The inspectors must be out doing their job strictly. We so often have children that buy biscuits and sweets and that from sponsorships that die from those. And that is a shocking behavior, and those things must be regulated.
Thank you. Okay, I am now going to give each candidate 2 minutes to share any feedback, responses, or comments relating to the NHI poll.
Thank you so much. We need a national dialogue on how health must work in this country. We can't just leave it to certain people who have power and so-called knowledge, because the health affects everybody. So the ACDP does not bring the NHI, but we do want everybody to get decent health care. We just think there's a better way. So we think there should be a national dialogue about that. Thank you very much.
Thank you very much. I think as we look at Africa, we are very clear on that. We agree with the school of thought that says we need universal coverage for all South Africans. But before we even get there, let's try and actually make it very clear that we need to rebuild and strengthen the current infrastructure that we have. The infrastructure of clinics in our communities, the infrastructure of hospitals in our communities, to make sure that both, number one, are accessible, number two, they are fully staffed with nurses and doctors and people that the community needs, but number three, also, they have adequate medication that they need. But more to that, we want to make sure that we train more nurses, train more doctors, let's reopen nursing colleges, and also making sure that we make nursing fashionable, because nursing is still the backbone of this country now. But on this point, we want to also try to say that corruption is the reason why most of us came out and said, in this current government, in this current atmosphere, the NHI is probably not the best approach at this point, because we know that corruption will always find itself in the policies that this current government tries to implement. So we must make sure that we cut corruption before they open another check for them to do it again. But on this last point, I just want to say that we need to make sure that I want to do this point to say that we don't think that the government has done enough to educate the public about what this national health insurance means for them and what it means for them since fighting against it. Does it mean that from today, if I really qualify, I can catch a taxi and go to St. Stephen's Clinic right away and get assistance there? People don't know that. How does it work? How is it supposed to work? And I think that the government has not done a good job in educating our people to make sure that they understand the implications and everything that comes with the national health insurance. But overall, we believe that South Africans should have access to universal health coverage.
Thank you. We support universal health coverage because the inequalities in this country are too deep and too vast. Majority of us don't have proper access. Some maybe have hospital plans, but even that is not sufficient to get full equal health care. And so we say that government needs to implement a bill that is a costed model, that has the right kind of funding model, and that actually provides services close to where we live. Now with this traveling to centers, that doesn't make sense. So for us, we support universal health coverage. We don't support the NHI bill because how can we trust a Marcella to do the same thing constantly? To run a NHI that doesn't actually is more about a money speed for them. So for us is to say basic health care needs to be 15 minutes.